I'm Prashant Bhatia. I'm a specialist ophthalmologist, and I'll be talking about ophthalmology in these times of COVID-19. So, how does COVID-19 involve the eye? What we do know is conjunctivitis. So, conjunctivitis can be an overall presentation of the COVID-19 disease itself, or it could rarely be an initial presentation of the problem. So, it's rare, thankfully, but it's been reported. The other thing we know about the eyes and COVID-19 is that the conjunctiva could be one of the modes of spread. So if there is an aerosol spread of the virus in air, technically, theoretically, there could be a chance of the spread happening through the eye itself, through the conjunctiva itself. So because of that, it becomes very important to keep the environment as protected for the patient, for the healthcare provider, and so that as a community we can keep the spread down to a minimum. So because of that, the recommendations across the globe from the American Academy of Ophthalmology to India to Europe is to limit ophthalmology to urgent and emergency care in COVID negative patients. COVID positive patients would receive their care in an isolation system, and that would be a different setup. Because of that, it's important to triage these patients to rule out the presence of COVID-19. So once we do that, what are the conditions which actually require to be seen in this day and age and these times? Which are the conditions which require an urgent care? Now, the commonest one, or the obvious one here, would be an injury to the eye or a foreign body. The other reason to seek urgent ophthalmology care would be a sudden drop in vision, or indeed retinal detachment. Now, retinal detachments would present with symptoms of flashes of light, small spots or floaters which suddenly increase in size or number, followed by a curtain coming in front of the eye. So, if there are any of these symptoms with a sudden drop in vision, these are reasons to go and see an ophthalmologist urgently. And the other common condition which require this would be an inflammation of the eye, technically something called uveitis or iridocyclitis. Now, this is something common in conditions where there's inflammation in the body, conditions like rheumatoid arthritis, where the inflammation can flare up in other parts. These patients commonly complain of pain, redness, and light sensitivity. So, if there are symptoms of being sensitive to light, certainly need to go across and have an eye specialist see, especially if it is something that's new onset, and especially if it's something which has just started in the past couple of days. Uncontrolled glaucoma, this is something which is typically picked up by another specialist with either with symptoms of pain, redness, watering, or seeing colored halos, or something which the patient might be aware of earlier. So uncontrolled glaucoma would be another reason to go in and get an ophthalmology check done. Acute allergies. Now, again, in this time, because a lot of us are indoors and a lot of us do spring cleaning or gardening, there can be an exposure, especially in those patients who are known to have allergies. There can be an exposure to allergens which can trigger things off, like pollen or like dust. So if there's an acute allergy, yes, it needs to be seen either by an ophthalmologist or by the emergency physician itself. And on the other side of the story, there are conditions which can be safely postponed or delayed till we have this COVID-19 issue behind our back. So the commonest condition that we see in our parts of the world are dry eyes and allergic conjunctivitis. Cataracts is something else which is very common, and unless the cataract is reached an advanced stage and where the vision is suddenly dropped and there's a risk of the eye pressure going up or the risk of the eye getting inflamed because of the cataract, which is thankfully very, very rare, most cataracts can actually wait for that extra month or so that we need to get past these COVID-19 restrictions. Certainly stable glaucomas are things which can wait, so a follow-up which was scheduled at 3 months can be done a month later, and refractions and regular routine vision checks are certainly things which can be postponed till we are past this quarantine period. For the earlier 4 conditions, do consider telemedicine option, which means talking to your physician, ophthalmologist, seeing if there's an option of having a teleconsult and see if it's something which he or she feels comfortable advising over the phone, and sending out a new prescription so the medicine can actually reach you without having to step out of your house. And in most cases, it is good enough to be doing that. What about the commonest symptom? Now, the commonest symptom which we see in ophthalmology by far is a red eye. While it would be nice to have one blanket answer, unfortunately that's not the case. It would depend on the cause of the red eye. So if the red eye is because of a foreign body or an injury, obviously that red eye needs to be seen in a hospital. But if it's because of a dry eye or a chronic allergy, that's something which can be treated over the counter, or like I spoke about earlier. So with a red eye, it's something where you need to talk to your ophthalmologist and have a chat and see if he thinks it's worthwhile for you to go in for an in-person check, or if it's something. And our recommendations across the world actually. So what about the general well-being of the eye? That's again a common question. We are at home more now, exercise is limited, so we are spending more time on the gadgets. Is it going to harm our eye? Our kids on the gadgets throughout the day, they're doing e-learning, e-schooling. Is it harmful? Well, no, it's not. It's directly, at least it's not. What it can do is increase eye strain, because we are obviously using these gadgets in a closed environment, most of the time with a lot of air conditioning. So air conditioning makes the atmosphere a little dry. And if you have a pre-existing dry eye, the dry eye is going to get worse. Commonly, we have a condition called computer vision syndrome, which causes a bit of eye strain after prolonged usage of gadgets. So how we need to handle that is, one, stay hydrated, drink lots and lots of water, and follow the 20-20-20 rule, which is every 20 minutes, look at something 20 feet away for 20 seconds. So 20 seconds, we all know nowadays how to count 20 seconds. Sing happy birthday to you in your head twice, and that's 20 seconds. So yeah, take those breaks, and every 45 minutes to an hour, get up from your PC, laptop, gadget, go and have a glass of water. Again, stay hydrated, take those breaks. And rest assured that just because we are spending a little more time on gadgets than we normally do, it's not going to harm your eye in any way. There are other ways of staying healthy and staying fit, and obviously this is not the best, but in terms of damage to the eye and harm to the eye, you're going to be just fine. Thank you, and stay safe.